CODIGOMAIS is an Interreg project focused on the creation of a cross-border ecosystem on health innovation in the European region Galicia Norte. The Euroregion Galicia and Norte has an extension of more than 50,000 square kilometers and a population around 6.3 million, with an average life expectancy of 81 years. The number of people working on R&D represents an 8% over the active population. The gross domestic spending on R&D reaches 0.89% in Galicia, while it rises to 1.35% in Norte. To improve research in this Euroregion and transfer the results to the market, CODIGOMAIS addresses three main objectives, which try to integrate those beneficiaries in a stable cross-border innovation ecosystem, open to all public and private key players in the health sector, through the creation of a common path for the valorization of market-oriented research projects, foster an open, integrated and interconnected ecosystem. A 5-year action plan was developed in a strategic plan for the ecosystem, which defines the priorities that the Euroregion has in health innovation. To foster new market opportunities, we create a new online platform to put organizations in contact with each other and to establish new scientific, technological, clinical or business associations. Promote an ecosystem that simulates market-oriented R&D and efficient services. To achieve this objective, an open call for research projects was launched, and a common itinerary for the valorization of market-oriented projects in the biosanitary sector was developed. The selected researchers participating in these projects attended one-week intensive training session focused on searching businesses, investors, licenses, business plans, and online marketing and valorization of technologies. Besides, some of the link management tools are going to be implemented on different services, such as pre-surgery, pharmacy and emergency of 3 main hospitals in the region. The end users will participate in the process, strengthen an ecosystem internationally connected. This will be achieved by establishing a network with relevant actors on health innovation in other regions. Within the framework of the CODIGOMAIS strategy, several reference regions have been identified, including Denmark and Sweden. The partnership, composed of governments, research centers and the industry, represents a triple helix model, which is a key factor for the ecosystem of health innovation. Let's know them in deeper. AFIS is the Agency of Knowledge in Health for the management of training, research, innovation and evaluation of health technologies in the Galician Public Health Service. It promotes 2 projects on medical devices, which are: Occlusion aortica focuses on the need to improve organ extractions from donors in cardiac arrest. This device reduces ischemic times in 3 minutes for the controlled asystole and in more than 5 minutes for the uncontrolled one. Anti-CD26 is an ELISA kit for the detection of anti-CD26 antibodies for the early diagnosis of the rheumatoid arthritis. ICHF Orome is a kit to identify patients with poor prognosis in heart failure. It is based on the combined detection of 2 proteins, orosomucoid and omentin. The International Iberian Nanotechnology Laboratory was created by the Spanish and the Portuguese governments with the aim to become the worldwide hub for nanotechnology. It participates with a project on personalized devices named Bio2Skin, which is an innovative medical addition biomaterial based on nano, which represents the new generation of medical adhesives. Within the University of Santiago, the International Excellence Campus, known as Campus Vida, counts with 30 years of experience in valorization and transfer of research results, and where more than 1,000 researchers are dedicated to biotechnology and biomedicine. The University of Santiago proposed 2 projects, one focused on personalized medicine known as Dentisan, which reduces the capacity of bacterial biofilm formation in the oral cavity through the application of problem-quenching technologies. The other one, known as calendula, is focused on technological application and allows the patient to access their medication guidelines, facilitating compliance with doses and schedules, improving adherence to treatment and increasing its effectiveness. The research group REDE from the University of Vigo focuses on two main fields: innovation management and operational excellence on one hand, and energy and environmental economics on the other. It proposes one medical device, Carioscope, which tries to develop a low-cost dental equipment to diagnose anomalies of teeth by determining the degree of mineralization of the enamel. One-third of the staff working at the Faculty of Medicine of the University of Porto are medical doctors working in the attached district hospital. The faculty introduces a project based on technological applications, Inspire Mundi, which aims to transform adherence to inhaled medication into a positive experience through gamification and social support. 2CA Braga is a non-profit partnership located in the city of Braga that focuses on clinical research, clinical care education, and on training teams. Cluster Saúde de Galicia boosts the competitiveness of the healthcare and social care sectors in Galicia, and it is responsible for catalyzing effective cooperation in R&D in this sector. Bioga brings together the organizations of the value chain of the Galician biotech sector and helps companies to access new markets. Health Cluster Portugal is a non-profit organization that brings together over 170 research centers, universities, hospitals, patient organizations, and private companies. For more information, visit us at codigomais.eu or visit our social networks.